David, would you give us the clap? Yeah. Good to go?
We're good to go.
Okay. Hey everybody, Ryan Henry with UCHRA here, the UC Recovery Podcast, and we've got Dr. David Reagan, former Chief Medical Officer of the Tennessee Department of Health, now board member of One Tennessee. How are you, Dr. David Reagan?
Doing well.
Good.
Doing well, Ryan. How are you?
I'm hanging in there.
Good.
I appreciate you taking the time and coming and visit with us and talking about UC Recovery and everything that's going on to get this thing going. You've been a part of UC Recovery even before UC Recovery was a thing. So how does a chief medical officer find his way to a project like UC Recovery?
Well, that's a good question. It was an interesting way. I'll try to be brief here, but when I was with the Department of Health, we were looking for ways to help healthcare kind of get back into the game of where people that took prescribed opioids, ultimately many of them developed an addiction, substance use disorder. And so we needed healthcare to be part of the solution to that. And healthcare, unfortunately, has been part of the problem in that. And so Governor Haslam and the legislature gave some monies to found a 501c3 organization called One Tennessee, eventually called One Tennessee. Yeah. And early on, we were looking for bright spots. One Tennessee was looking for bright spots, places around the state that were doing just better than you could normally expect to happen. And we had a statewide virtual conference because it was COVID time. And we were introduced to One Tennessee and what Upper Cumberland is doing in the region to try to deliver services to clients with substance use disorder that were so much faster and so much more comprehensive than we saw in most parts of the state. We were really impressed and began to talk and try to understand better what was going on. For instance, the goal was if a call came in, a certified peer recovery specialist would be able to meet with that individual within 2 hours. We thought that was amazing, and it was. And if someone needed inpatient treatment, that your goal was to get inpatient treatment within 72 hours, and you were doing it. And we thought that was really amazingly good. So we began to work, and as we began to learn a little bit more, we began to really think this is an effort that makes a whole lot of sense, and that healthcare could come along in ways as collaborators to help parts of this out to make it a bit more comprehensive and easier for clients.
Wow, that's impressive. How did you come a part of UCHRA? How did that partnership come about?
Well, we were really talking about, what are the barriers to getting people into treatment? And inpatient treatment is the scarcest resource that we have. It's the most expensive resource, that we have. And so while it's become more available through additional funding through federal and state programs, nonetheless, it remains the most scarce resource. So we were thinking, how can we work together to create a process where people could be individually evaluated for what they needed. Not everybody needed the same thing, and there's not one path to recovery. There are multiple paths to recovery, and all of them are really precious. Mm-hmm. So we began to work together, put our heads together, and try to take some national standards and try to say, how can we apply some of these and join them together with the Upper Cumberland Recovery Connect program to the benefit of the clients.
Wow. So during this conference, you were introduced to somebody, Glenn Says?
Glenn Says.
Yeah.
We connected with Glenn and got to know Glenn and really appreciate him. And, he was, along with Mark Farley, he was really, they were both just so essential in the beginnings of this. And it's been great to work with them and it's been great to work with Mark for a number of years now.
What have been some of the, maybe early on, some of the challenges to getting a project like this kind of out of dream state and into reality?
Well, I think there are a lot of challenges. You know, when you look at it, the care system for people with substance use disorders has been pretty fragmented, and that's a lot of different organizations are involved. There are a lot of different steps. There are a lot of different hurdles that people have to go through before they have access to those. It's hard for anyone, honestly, but especially someone who's in the throes of substance use disorder, to navigate that system, to really understand it, to navigate it, because it's not logical.
Right.
So
yeah, it's not a linear thing. People recovery.
Yes.
They recover in such different
Yes.
ways. There's different problems that have to be addressed
Right.
at different stages.
Exactly.
And sometimes you have to go back and address that again.
Right. So I had seen some of that. I'm a physician, and I had seen some of that as a clinician with my patients. I had seen some of it with neighbors in my neighborhood. You know, when I live in Johnson City, when I stand on my front porch, I can see 3 neighbors' houses where 3 different people have died from opioid overdoses in my own neighborhood. And then I've seen it, you know, as when I was with the Department of Health, I kind of had a front row seat to the development of the epidemic in Tennessee, and we spent an awful lot of time trying to help out with setting up things that would help healthcare to be able to respond to it more effectively.
Yeah.
So it was really complex, and it was the first time that I ever really dared to imagine that there could be a regional system that was integrated, that was focused on the needs of the client whose life was being upended with substance use disorder.
Wow. We think about challenges, but out of those challenges, we have some statistical numbers. One of them that kind of stand out to me was the number of justice-involved people that we've encountered through this program.
Right.
Since March of 25.
Right.
There's been 322 people out of probably almost 600 that are involved in the justice system one way or another.
Right.
And only 11 of those 322 have gone back into whether it's reincarceration, had to go back and start probation again.
Right.
I think that really speaks to something that's going on here.
Yeah, and that was actually while they were with the Upper Cumberland Recovery Connect project, and I think that's huge. You know, recidivism is a massive problem and a common problem, and you know, this is very encouraging to think that that while people are plugged in and they have an advocate in the system, that CPRS who is working with them is kind of their touchstone into the system, and if they have changes that they need resources in different ways, they are there not just to tell them what to do, but literally to walk with them to getting that need taken care of. I think that's that's
the secret sauce.
It's the secret sauce. The magic of this is you get to know someone who's walked in your shoes before, and they know how to walk with you to to take the next step, to cross the next bridge that needs to be crossed to help you have a path to recovery.
Yeah. We talk a lot about building a recovery ecosystem, and the medical community is part of that ecosystem.
Right. That's right.
What benefit does a program like this bring to the medical community?
Well, honestly, the medical community is part of the fragmentation. You know, we have generalists, we have specialists, you know, we have subspecialists. There are so many. Everybody's sort of siloed by their training dimensions. You know, psychiatry and internal medicine and emergency medicine and surgery, and so all these, and they don't always really talk to each other in the way that they could about a client with something like substance use disorder that is underlying so many of their medical problems. And even for a physician, especially in a rural area, to really navigate that system efficiently from an office perspective, It's very hard, very challenging.
How does an issue kind of like substance abuse, mental health, how does that affect the medical community? Just knowing from what you've talked about and some research I've read, it really affects the emergency department.
It certainly does. Substance use disorder is a chronic and often relapsing disease, and as are so many diseases that we treat in medicine. Hypertension, diabetes, asthma, you can go on and on. The list is quite long of chronic relapsing diseases. And so in that sense, it's not very different, but there's a lot of stigma around substance use disorder. And that stigma, unfortunately, is still present in many healthcare settings. And so you end up having people have more barriers to getting effective care in a fragmented system. The emergency department may not have ready access to programs normally, like Upper Cumberland Recovery Connect, and it may not be part of their workflow. And then there are stigma challenges with treatments for substance use disorder and which is best for that individual. And it really takes some specialty expertise to do to answer that particular question for the patient. So there's a lot that goes into it, and that's where I think it's the opportunity that Upper Cumberland Recovery Connect has, is to create that ecosystem, as you called it, but that integrated system where someone just needs to get referred or make a phone call themselves or their families or one of their friends, and they end up in a system that then will help them navigate all of that. And it as you pointed out, it helps in a large number of ways, and one of them, justice-involved patients have been much less likely to have new problems with justice. So I'm just really pleased to see the 1 year results like that.
I look forward to seeing as we pursue funding opportunities to see what kind of effect UC Recovery has on our local emergency department system, how that reduces ER visits, how it increases connection to resources for the emergency services. Now, these days, there's Tennessee Recovery Navigators who work inside hospitals, specifically in the ER, and I know some personally that they are making an impact, but just like anything else, there's such an overwhelm of need. If I could wave a magic wand, there'd be a CPRS, a UC Recovery in every county of the state to combat that. You recently went to a summit.
Yes.
RX Summit. What was the big takeaway from that experience?
Well, that's a really good question. It's also a hard question because this was almost 4,000 people from all around the country. All 50 states were represented there, and so there was a lot going on. But I think some of the biggest things was just reminding what we've known to be true for some time, but sometimes it doesn't. We don't think of it this way. But substance use disorder is a chronic relapsing disease, but it is treatable. And just like diabetes, hypertension, asthma, they're treatable diseases. Are they curable? I mean, not. I mean, you may have to take care of them the rest of your life. Hypertension, maybe especially, or asthma. But it's just like that. And most people with substance use disorder do in fact get into long-term recovery. And you kind of forget about that. We think about the tragedies of overdoses and overdose deaths, and absolutely there is tragedy there.
Sure.
But even at the conference, we heard where in 2024 there was about a 30% decrease in the overdose deaths in this country. That's huge. It's huge progress. And we just heard that the preliminary numbers for 2025 are that there was about another 15, maybe 18% decrease on top of that 30% decrease from the year before. So, I mean, if anybody had questions, can you recover from substance use disorder and be in long-term recovery for decades, years, the rest of your life? Yes, you can. It's just there's unfortunately a lot of barriers there, and that's, I think, one of the roles that UC Recovery really helps to address.
You talked about people being in sustained recovery. According to the numbers of UC Recovery, there's over 180 people that are in recovery. Can you? I'm getting going down a little bunny trail. Can you explain maybe what the different stages or phases of recovery? We have early recovery, sustained, and stable. What is that?
So recovery sounds like it ought to be really easy to decide who's in recovery and who's not, but actually it's a little bit more tricky. We have recently gone with this definition, which has been nationally recommended, but not totally adopted yet nationally. So early recovery is when you've got 1 to 6 months where you've been in treatment and now you are not in that cycle of use and then withdrawal and then use and then withdrawal, and that's great. Those cravings, have largely been resolved during that period of time, and your brain is capable of really processing the treatment and the steps in moving toward full recovery and reintegration with your community. But you're early. The sustained recovery is 6 to 12 months, and you're just building on the advances of the first 6 months, but you're more stable. Some people call it recovery capital. The resources that you have that you can apply to your recovery are much greater. You may have gotten stable housing, you may have gotten stable transportation, you may have gotten a job or gotten in a promotion at your work. You may be now in an educational program that allows you to get new skills that will make you more accessible to a better job. And for a lot of people in the area of family reunification, where there's been a separation with kids or there's been separation from parents and friends, now many of those relationships are healing. And then the last one, the stable recovery, is more than 12 months.
Wow.
And if you can get to more than 12 months of recovery, the probabilities that you're going to stay in recovery are very good. It's not that nobody ever goes back at that point, but what we find is a lot of times the amount of time that they end up out of recovery, but they know recovery is possible, is shorter and shorter and shorter, so that they can they can have a brief period of time and say, no, that's not who I want to be. I know I can do this, and they do. They have the support. They know where to go for the support. They've got the coping mechanisms, and they're able to then make that a very brief period of time.
Wow. What has been your proudest moment just overall in this project?
I think the proudest moment is when you meet people and hear the stories of people whose lives were hijacked with substance use disorder, and that's no longer true. And you hear the stories of these are really their accomplishments. More stable housing, better transportation, career advancement, educational advancement, and the healing of family bonds. That those take hard work, and they take commitment, and they happen slowly over time usually. But those are achievements of people whose lives are now being healed from substance use disorder, and that's frankly what makes me the happiest of all.
We've talked a little bit about the recovery ecosystem, and as far as UC Recovery, the next phase we're looking at is getting in recovery to work, getting people back to work. What are your thoughts on that?
Well, I think it's really clear from a lot of studies that having a stable job is such a huge benefit towards recovery, long-term recovery. It when your life is when you're not sure where you're going to sleep at night or how stable or how safe it is, it just doesn't help your mind to focus on the recovery process. And I think it makes you feel more vulnerable, and it makes it more challenging to continue in recovery. So these things, the recovery capital, a lot of people call it, these are just markers that real, honest progress is being made, and you're in a better situation to deal with. If you have a relapse, you're in a better situation to deal with it. And relapse, it doesn't put you back at square one. Relapse might not put you back hardly at all. It just all depends on how you respond to that.
Right.
And so I think that would be my answer.
Yeah. It's amazing to see. Like you said, I've been fortunate to see some of these folks from square one. And all these things build and build. It builds confidence, hope.
Yeah.
When somebody gets that job, there's such a sense of purpose they find.
Right.
That's it's really encouraging to me to just have seen all this work early on, and it really is coming to fruition. These dreams that started with Glenn Say's and your experiences and all these pieces coming together. It has been a wild ride to see all that, and just you're able to imagine what's the future look like.
Yeah.
And that's my question to you is what do you see this going? What do you see the future looking like for UC Recovery?
Well, one little comment before
Sure.
I get to your question, but I just want to do a shout out to the people in recovery, because it's not easy to get there. It's tough, and yet it is possible. Mm-hmm. And stable recovery is such a better way to live. It's just phenomenally better. And one thing that we haven't said so far, but I really respect people who have gotten to stable recovery, is that they want to give back. It's just not all about them. There was a period where they could hardly make ends meet.
That's a good point.
But their heart is to give back, and they do it with great enthusiasm, and they can understand in ways that I will never understand how to help, how to reach out, when to be firm, when to be empathetic, and how to mix that together. And so I just what I see are people who I honestly, genuinely respect and admire, and they are role models. They're not just back in their life; they're role models. And they go above and beyond, and they go above and beyond in Upper Cumberland Recovery Connect.
Yeah, that I appreciate that comment. And that's really the core of UC Recovery are the peers, the ones that have been there, done that. They got the T-shirt, and now they're giving back, and they're letting it known that recovery is possible. Yeah, for me, I survived a 12-year OxyContin addiction. There is no logical reason I should be sitting here talking to the former chief medical officer of the state of Tennessee. There is no logical reason for that, and that's just a testament to what recovery can do. The sky's the limit, but they've got to put the work in. The willingness, and I've seen it with my own eyes. I've lived it, but I have seen it happen to other people, that the switch is flipped and they get it and they're just off and running. And if nothing else, this project has given 14 people a sense of purpose to give back and to lead others out of that darkness. And I thank you for your compassion, your energy, your passion for the issues that we're trying to tackle. It's been a pleasure, and every time I get around you, I'm like, all right, Doc is here. We're gonna get excited and change the world. What's up? We're going to wrap up here in just a minute. What's one thing that most people don't know about Dr. David Reagan?
I guess maybe one of the most unusual things is I have a hobby of photography, and I've had that since college. My dad actually liked to do family photos, but he kind of, I think, gave me my love for that. And I love to do landscape and portrait photography, but I kind of got a few years ago, gosh, it's been almost 10 years ago now, I kind of got aware that you can actually take pictures of objects in the sky, celestial objects. And I enjoy doing that. The universe is an absolutely incredible place. It's an awesome place, and we've lost the meaning of that word awesome. Everything's awesome, and so nothing is awesome. But when you look up, and we're not able with our eyes to see so much of it, but if you even put a small telescope up, you can see a lot more. And if you put a camera on the end of that telescope and you have a mount that can track the rotation of the Earth, you can see some things that are just really remarkable. And I get a strong sense of awe out of how incredibly complex, how incredibly intricate, and how incredibly amazing this universe that we live in is. And here we are. We're beings that can appreciate that, and we have spirits that can be awed by that.
This guy, he showed me his photos earlier, and they are National Geographic quality. Like, I was looking at it and like, are these even real? And they were real pictures of galaxies and pulsars and supernova.
Nebula clusters.
That was
yeah.
Amazing. They were really pretty.
Eclipses are cool. Yeah.
Well, hey, thank you guys. Thank you, Dr. David Reagan, for coming. To find out more about UC Recovery or any of the programs and services at Upper Cumberland Human Resource Agency, visit uchra.org.